name is Summer. I'm a student at McKendree, and this is part of my project, is to do a presentation to the community, and I'm doing mine on risky sexual behaviors of your population, the teenage population. So the first thing I wanted to start with, the first section I wanted to start with is some statistics I found. For the Centers of Disease Control and Prevention, we did find they do a survey every couple of years, and they did a survey of the United States high school students, and found that almost half of you guys are sexually active. So that's almost 46.8, or it is 46.8%. That's almost half. I kind of found that one was a little staggering. I didn't realize that half the population, that includes freshmen all the way through seniors, are sexually active. Another scary part of that is that of those 46.8%, 41% of those students did not use a condom the last time that they had sex. For whatever reason it might have been, they were in a relationship for a long time, or they didn't like the condom, or whatever it was, they chose not to use it, which that's a pretty risky thing to do, and we'll get more into that later on in my slides. Of the new cases of sexually transmitted diseases, 19 million of them were found. Nearly half of them were of your age group, from 15 to 24 years old. So you guys are right up there in the top group. Some more statistics I found. I was looking more locally in our counties, in Marion County and Clinton County. We have the highest rates of gonorrhea and chlamydia. And this is including, Washington County, Jefferson County, and actually we're pretty high up there that Chicago, Cook County are the highest. They're higher than you guys, but for us being just a little small community town and everything, that's pretty scary that we have those high statistics. In my slides, you'll notice, see like the second bullet there, it's bolded, that little quiz I gave you a couple weeks ago before I left. You'll get that same quiz at the end of my presentation, just so I can see how much you might have gained from the presentation, what you learned. So in my presentation, I bolded bullets, and those are the answers throughout my presentation. I'll give you answers to the quiz again, so you'll get the quiz again at the end, and hopefully you've learned something. So this bullet in particular is saying that your age group, teenagers and young adults, they're the most likely to have an STD. So it's not the people in their 30s or the elderly, it's you guys in your teenage years, in your 20s. And then the last one I found was that the United States now has the highest rate of teenage pregnancy among industrialized countries, which I was telling earlier that in the 1990s and early 2000s, we've kind of gone down for a little bit on the rate, but it's just spiked right back up again. A couple of different education programs that are out available now are abstinence education, and there's another one called comprehensive sex education. We talked about abstinence first. It basically means you're not participating in any sexual activities at all. That means, oral sex, anal sex, vaginal sex, none of it. You're just abstaining from it until either marriage or you decide you're ready in a long-term commitment. This is being taught to teenagers and young adults in schools. There's still federal funding for it, but in a lot of the research I found, they're finding it's not as effective as giving the information to you guys that you need to know. The next type of education is kind of like what I'm doing today, where I'm giving you all of it. I'm telling you, the good and the bad and the ugly and the STDs and the pregnancies and birth control. That's the comprehensive sex education. I believe you guys had that in freshman year here at the school. You might have got a little bit before you came here at different schools. We talked about, grade schools and junior highs kind of offering it, but I think they were more just like, sex, no, bad, don't do it, But you guys are young adults. You really need to know this kind of stuff because it really does affect you later in your life if you make poor choices, and I'm sure you guys know that. It's not it's not mandated at all to have any of this, abstinence or the comprehensive. You don't, it's not mandated by law for every state to do it to every school. It's by choice. There's only 22 states that have made it a mandate through their government, but it's not something that every kid's going to learn across the United States. And I think you can see that in the statistics that maybe we should. I think honestly you guys should probably be getting it every year, especially in high school. Sexually transmitted diseases and infections or infections. It's, both terms are interchangeable throughout the research. There's nothing different between an STD and an STI. They're the same, it's just the word diseases and infections. That's obviously the huge risk of having sex is the possibility of the disease. As you can see, I got another bullet highlighted here, and it is not easy to tell if a person has an STD. They might not have symptoms. And a lot of the STDs I'm going to go over with, they don't have symptoms until it's too late. And you have it. You've already passed it on to somebody else. So that's one of the questions on my quiz is, is it easy to tell true or false? And it is definitely not easy to tell. This was something I didn't know. There are 20 different infections that you can get sexually transmitted. And I would have pegged maybe 10. I couldn't even name 10 right off the top of my head to begin with. But there's 20 different ones. The next bullet I wanted to talk about is, this is actually 2 questions. One of the first questions on the quiz was, can you get herpes from a toilet seat? No, you can't. It's a virus and it cannot live on the toilet seat long enough to be transmitted. But you can get herpes from sharing a glass, a drink, a kiss. You can get herpes that way, and it's oral herpes. It's HSV1. It is contagious just like any other virus, but it's not the sexual type of virus of what you think. Many people have cold sores and fever blisters. I know personally I get them myself. It just, you can get it from your mom whenever you were a kid and you still have it because it's never going to go away. So I just wanted, that's part of the quiz, is you can get it from sharing a glass, oral herpes, but you cannot get herpes of any kind on a toilet seat. So the future slides I'm about to show you are the STD slides, and all my information, my resources came from the National Institute of Child Health and Human Development. And I'm just going to let you know, like I've told them all, that's why I put it at the bottom. They are very gruesome pictures. I found the nastiest, grossest pictures I could find on the internet to show you, because you need to know these are just bad. So they are. No. I mean, you would have to be really on top of that seat, just, doing it. I don't know. I don't see it happening. And the person before you would have had to do it too, so it just, no. We will go into a little bit of a bacterial issue later that there is with other things, but anyway, I do want to warn you the slides that you're about to see will have pictures that are gruesome. So if anybody has a weak stomach or is squeamish, you might not want to watch.
Put your head down and go night-night.
No, don't go night-night.
Just put your head down.
Close your eyes, put your head down, but at least still listen to what I'm saying. But other than that, yes, I just wanted to give you that heads up. So, does anybody need that? Are you guys okay? You all good? Okay, I'm going to get started. The first STD I wanted to talk about is chlamydia. It is bacteria, and it is, like I was saying earlier, in Marion County, it's one of the high ones. Now, the picture you're seeing right there is actually the inside of a female vagina, and that is pelvic inflammatory disease. That's where it's all inflamed and the unusual drainage, and this is a severe complication from the disease. The actual STD, when you get chlamydia, you might have symptoms, and those are fever, abdominal pain, and unusual drainage. And then again, you might not have any symptoms at all, and you could continue to pass it on. And it might be to the fact where your symptoms aren't severe enough to go get treated, you leave it untreated, and this is what happens on the inside. And I'm assuming this picture was this woman went to the doctor, was like feeling something going on down here, it was hurting, and she's found it. And if it is continued to be left untreated, this can cause problems with having babies later on in life, cause sterility, organ issues. It can really damage the insides. It is curable. You can take antibiotics, penicillin or tetracycline or something of that effect. So there is a cure to this one, and hopefully once you get a dose of antibiotics before you decide to have sex again, you want to make sure whoever you did have sex with before is also tested and treated, otherwise you can just get it right back. The next one is gonorrhea. And gonorrhea and chlamydia kind of go hand in hand. Actually, doctors usually, if you have one, they're going to give you the medication and it's going to treat both of them. Because this is another bacteria as well. That's just a microscopic picture of what it is. This here is the tip of a man's penis, and it's got the drainage coming out. Usually your painful urination, abdomen pain again. If it's left untreated, it's similar to the other. It can affect other body parts, and it shows pictures of the hands and the feet where they're getting sores. It can also lead to that pelvic inflammatory disease in females too, and really damage the insides and cause problems with having babies later on in life. So the next disease that I'm going to go through is syphilis. And it's another bacteria. This is the last disease of the bacteria. It usually doesn't have symptoms, again. And this is why I wanted to bring up the bacteria issue. You can get an STD from a sex toy, and that was where I was saying, like the fluids and the bacteria where they're passing it between people, I don't know what people do, but anyway, if it's not cleaned properly with a bleach type solution or whatever is an appropriate solution to kill the bacteria, yes, you can get it from a sex toy, an STD. Syphilis is another one like chlamydia and gonorrhea. It's a bacteria and it is curable. You can take a course of antibiotics from your doctor and it can be cured, but it can also come back if you don't get that other person tested or the symptom that does show up is a painless canker sore. That's what this picture is down here, the oval-like shape. If you don't even notice that that's there and you're continuing to have sex, it can be in a fold somewhere, it can be down below, there's all kinds of areas for it to hide. And if you continue to let it go untreated, it'll lead to the second stage, which is actually where the hands, you see the picture of the hand there, it's a rash all along the palm of your hand, and it can lead, down to your trunk and the soles of your feet, there's a rash there. If you continue to leave that go, and it gets into the latent stage, and the last stage of syphilis, it'll end up causing paralysis, dementia, blindness, and death. It can get pretty severe if you let it go. So that's the last of the curable diseases. Now, these diseases do not have a cure, and these are the viruses. This is a picture up top here of genital herpes, and that's why this bullet is bolded, because there is not a medicine to cure each STD, and that's one of the quiz questions, is there is a medicine that can treat this as far as symptoms. It can make it easier for the person that has these. These are painful, watery, discharged blisters, and I wouldn't want to wish that on anybody, but they do have medications, Valtrex and other antiviral medications that can help keep those blisters at a minimum. They call them outbreaks. You can still give an STD to a person, even though you don't have the blisters. You still have the virus. You're going to continue to have the virus forever. There is no cure. It will lay dormant in your spinal fluid, and it flares up, and it goes back in. And that's where the oral herpes comes in. Normally cold sores or fever blisters. They're still in your body. You're not going to get rid of them. And so like I was saying, though, if there's no symptoms, if the outbreaks are cleared up, you still have the disease. So if your partner has not had it, and he's not got it, and he's tested, or she, vice versa, you want to still be protected and use condoms and things like that for that. The next disease, this is the most common STD, and the reason it's bolded is that was the last question on the quiz. The most common STD in all age groups, not just your age group, is HPV. And majority of that is, there's 40 different types of this virus, and a lot of them don't have any symptoms at all. If they do have a symptom, though, most of the time it's this up top of the picture. It's like a little cauliflower wart is what it is. And they can be in all different various places, usually around the genitals, obviously. But there's 79 million Americans infected with HPV. And a lot of them don't know it. I mean, for this purpose of, research, we obviously know they were diagnosed, but there are a lot more than that running around that have no idea that they have it. And, we were talking about these genital warts earlier. Do not try to use over-the-counter wart remover, because it will not be good for you, and it's not gonna go away. This is definitely of need of professional. There's no cure for this. You can use symptom treatment again, similar to antivirals as the genital herpes, but there's no cure and there's no medication. But there is nowadays, in the last couple of years, we've done a Gardasil vaccine. Have any of you been able to get that? Yeah. I recommend all of you get it. You're all in the age group.
What does it do?
It does, and it's a 3-step shot process, and it's, yeah. It does, it hurts, it's a shot, it's painful, but once it's over, that is great protection, because we were discussing a couple of the HPV viruses can cause cervical cancer in women, and they can cause throat cancer in men from oral sex. And so this vaccine is good for boys and girls. I wasn't able to get in on that time frame because it came out after I was 26 already, but I have boys, and they're 13 and 9, and they're going to get it. So I'm just saying I recommend it for all of you, whether you're, vaccine or anti-vaccine, that's up to you guys, but I would recommend it. It's a very good thing just to get in there and have that extra level of protection available, especially since there's no symptoms most of the time. The last virus is the big one that we, most of us know about well, is HIV. HIV is that virus that stays with you forever. There's no cure as well, but it can progress into AIDS if there's no treatment. There's newer, more intense medications that are out there, antiretroviral medications that can help you from getting AIDS, from it progressing, but it is very expensive. But, if you end up with HIV, you're more susceptible to all types of diseases, especially STDs, but also, pneumonias and MRSAs, infections, everything, because your body has now lost its immune system, basically, with this virus, and it's going to be there forever. The last bullet is on your quiz. It's about a negative test does not mean you're in the clear. You could test for HIV tomorrow after having sex, and it will be negative, most likely. It'll just, oh, no, you're good. 3 months later, however, if you get tested, it could show up. Or 6 months later. And I told the other classes, I'm a nurse, and I've been a nurse for 3 years. I've had 2 needle sticks incidences where I've had to get tested for HIV. And I've had to go back 3 months later, I've had to go back 6 months later, and I had to go back every year just to make sure, I didn't catch it from these needle stick injuries. But, having sex, you think you go to the doctor and you're all clear after having sex with somebody a week ago, and next thing you know, 2 months, 3 months down the road, you have it. And then you have to go back and tell that person they want to get tested. So a negative result is not always a good answer. When we're on to teen pregnancy, I was telling the other classes, I found this picture and it just bothered me. But, I had to put it on there. They want to call MTV because they're, 16 and pregnant. Awesome. No. Anyway, obviously a risk of having sex is being pregnant and having a child. And this, makes in the research I found several studies were that the mothers obviously had an increased risk of dropping out of school, being a victim of poverty, being on state aid, welfare, food stamps, all those things, not going on with her career in college. And it also affects the baby. They're at risk for low birth weight, higher chance of death, and being exposed to abuse. I also talked about earlier, did you guys hear about the little baby that died not too long ago in Salem? Her mother was only, 23, and had a couple kids already, and, that baby was subjected to abuse, obviously, and died for it. And it's a sad, sad story, but unfortunately, when you're a child and you're still trying to learn yourself how to be an adult, and then try to take care of a baby, and it is stressful. Even when I was an adult and had a baby, I still was stressed out. So The last slide we're gonna go over is birth control. I have some samples I'm gonna pass around as we talk. The first one is obviously abstinence. If you don't have sex, you shouldn't have much to worry about, so it's a good thing. We talked about a little bit about abortion. Some people use abortion as a method of birth control. This can actually tear up the body, and it's definitely a mental issue that you'll have to deal with too, that you decided to use that as a birth control. Next slide, or the next bullet is bolded, because on the test there was a thing about birth control pills. They do not protect you from STDs. All they protect you from is pregnancy. And that's only if you use it at the same time every day appropriately. You don't miss a dose ever, and you don't take antibiotics, because if you do, then you have to use a condom. It's very regimented, and still people get pregnant. My best friend's got 3 babies that were birth control babies. So they were she was all on the pill every time. 1 condom is more effective than 2. That was a question on the test as well. No 2 condoms, not 6 condoms. You don't want to do more the merrier, because it will cause friction. They will rip, they will tear, and then you're just basically useless. So 1 condom, and we want to use, a good condom that's in date, that doesn't expire. Go ahead and pass that around, please. If it expires, throw it out, because it could rip, it could tear easily. Try not to, use it in your wallet, your purse, leave it there for months at a time. All that good stuff. Just keep an eye on it if you're going to use one. The male condom is the only form of birth control that can help prevent STDs. Everything else only prevents teenage pregnancy, or not just teenage pregnancy, but pregnancy. So the male condom is the only one. In this little baggie, there's a female condom in here. This does not protect from STDs. There's also a diaphragm in there. It's very odd. Don't worry. It's the female condom and the diaphragm both. They're a little flexible ring. They're little plastic sheets similar to the regular male condom, but they're a lot larger, obviously. And you squeeze it and you insert it into the vagina, and it catches the sperm and the semen, so that way you can protect from getting pregnant. Doesn't have to protect from STDs, though.
Is that only one in there?
There's 2. There's a diaphragm and a female condom in there. So there's 2 different. But they're both about the same mechanisms behind it. A Depo-Provera shot, that's something you get just like a shot, like an injection, and you get that every 11 to 13 weeks. Every 3 months. And, well, it's good, but there's some side effects, there's like some weight gain, and there's, what was the other thing we talked about?
What happens to your period?
Oh, your period either stops or is very irregular. Yeah, it's either irregular or it stops altogether. Emergency contraception, we talked about that Plan B. You guys have heard that on the TV or in the commercials. They've now made it to where it's legal. You can go, if you're 18, you can go buy it. If you're not 18, you have to get a doctor's prescription. You got to take that between 48 and 72 hours after, unsafe sex. I was telling them earlier that I had to take this once after I was raped when I was 19, and it wasn't nearly as, it was hush-hush. This was nothing that was discussed. It wasn't out in the open. And it's something that I think that it would eventually have long-term effects if you try to use this as a regular type, because you're actually trying to abort something that might have happened. The Plan B, I don't think it's a very appropriate, consistent birth control, such as using condoms every time you have sex. The implant, I have a sample here. This is like supposed to be somebody's arm. You'll feel the little stick in there. Pass that around, please. It's a little birth control that's for 3 years, and you just leave it. They surgically implant, it in there, and then they take it out when it's done. Some of them do. If you get somebody that doesn't know what they're doing, and you can have complications where it bruises and it
Mine was harder.
You can. A lot of the birth controls for females, unfortunately, that is a side effect. A lot of them, because you're messing with your hormones. The other one I have. Sorry guys, I gotta get through this. But, the other one I have is, this is the representation of a female uterus, intrauterine device. doctor or gynecologist inserts that into the uterus. That's a long-term one, kind of like the implant as well. It can be there for 3 to 7 years, or 3 to 10 years, I believe. The NuvaRing, I'm sorry guys, I keep your attention a little bit. It does not come on this string or in this little package. It's just this little plastic flexible ring. That's something for females as well. You insert that into the vagina and you leave it there for 3 weeks. Yeah, I think that's it. 3 weeks, and then you take it out and have a regular period and put a new one in. We had discussed earlier, somebody had asked something about it falling out or if they lost it. It does come out. It does come out, and it has come out during sex before. And you wash it off and you put it back in. That's just kind of one of those things. And or you just go get a new one, however you need to do. But it's easy to get in and out. It doesn't go past the cervix. If you have troubles getting it out, you go to your doctor. They'll help you. That's a birth control. It's like a 3-week long birth control. Kind of like that. It's flexible. It's squeezy. Yeah, kind of like I would say like a tampon. You know, you just squeeze it, put it in there. So. The Ortho Evra patch is something different. It's just a little square patch. It delivers the hormones on the skin. You just like it's 3 weeks. You take it off and you put a new one on after that week. You have your menstruation. And you just rotate the sides around. With the NuvaRing and the patch, there's risks. If you're a smoker, you get blood clots. If you're older than 35, they don't usually want you to have one of those either. And then the last one we have is sterilization. That's usually for older people. Probably none of you guys will ever be offered that because they want you to have the chance to have babies. But that's vasectomies, tubes tied, hysterectomies, and things like that. And, even my personal gynecologist, I told him I wanted my tubes tied after my second one, and they were like, you have to be at least 26 at this time. That was a while ago, but they had specifications. They weren't just going to let you say, oh, okay, you're 18, let's do it. No. So that's just some of the birth controls that are out there. And somebody asked something about a male birth control pill. There's nothing out there for that. So, and the only thing I've ever heard of males taking them is if they want to change to a female. So that's about it on the male birth controls. That's the condom for them. And well, it's different. There's progesterone and estrogen. There's different hormones. They're all balanced. Any questions? I'm going to go ahead and pass out this quiz. Let you guys take it. We'll get to that here in a minute, okay? On the test, it's the same one you've already taken. No pressure. You don't have to write your name on it if you don't want to. I would like it if you don't mind to write comments on the bottom. How you felt I did. If you learned something, or just put a little note down there if you can. If you don't want to, that's fine too. I'm no pressure. So, thank you. That was pretty much it. And we'll talk questions now. We can go ahead. I'll try to answer them the best No, you don't have to if you don't want to. Hold on just a second.